नमस्कार, मेरा नाम है विवेक शर्मा। मैं एक सोशल एंटरप्रेन्योर हूँ और काम करता हूँ कैंसर में और मेंटल हेल्थ में। और आप मुझे देख रहे हैं आज जीयू ईयर एंड रिव्यू, यानी कि एक कॉन्फ्रेंस है जो चल रही है मुंबई में। और यहाँ हम बात कर रहे हैं सेशन अपडेट्स की कि क्या चल रहा है भाई। और हम बात कर रहे हैं जाने माने विशेषज्ञों से जो कि कैंसर में स्पेशलाइज्ड हैं। एंड हमारे साथ आज हैं डॉक्टर चिराग देसाई। डॉक्टर साहब नमस्कार और बहुत बहुत स्वागत है। सर, आप अपना एक ब्रीफ इंट्रोडक्शन दीजिए और हमें बताइए कि ये लोग आप क्या सेशन जो है यहाँ पे डिस्कस करने वाले हैं, क्या बात करने वाले हैं।
So, namaskar and thank you very much. I am Dr. Chirag Desai, a practicing medical oncologist in Ahmedabad. My session tomorrow is about the treatment of managed metastatic urinary bladder cancer. So, urinary bladder is the organ which collects the urine from the kidneys and passes it on to the urethra for urine to come out of the body. Now, urinary bladder cancer is one of the common cancer and usually being treated by urologists, my urology surgeon friends. Most of the time, this cancer is found in the early stage, and early stages with appropriate treatment, it is curable. But very often, in spite of being found in the earlier stage, it keeps on recurring, it keeps on coming back, and at some point in time, it does have a metastasis. Metastasis means spreading from organ to another organs, right? So, most of the common sites for urinary bladder cancer to metastasize are lymph nodes, bones, lung, or liver. Now, once metastatic, this is a very aggressive cancer and it kills the patient, right? And that too very soon. So, on an average, only 5% of the patient make it to about a year or so. Most of the patient with the treatment of yesteryears used to survive between 1 and 2 years. A lot of things have happened in last few years. The first thing is that we have good chemotherapeutic agents which improves the survival to some extent. But soon after giving chemotherapy, we are giving an immunotherapeutic drug called avelumab, and that is improving the survival significantly. And now most of the patients treated with chemotherapy followed by avelumab are surviving for about 2.5 to 3 years, right? Beyond that, we used to have no treatment beyond avelumab, but now we have a number of other monoclonal antibodies like pembrolizumab and durvalumab and so on and so forth. And post that, we have what we call antibody drug conjugate. In simpler words, they are the targeted therapy, they are the targeted missiles which are attacking directly on the tumors and not on the normal cells of the body. So, more effective and less side effects, right? So, at present, we are giving these drugs after chemotherapy and immunotherapy, and there are two drugs. One is called enfortumab, another is called sacituzumab. Tongue twister names, don't try to remember those names, but they are available, right? So now the trials are ongoing where these drugs in combination with immunotherapy are being given earlier on, right? And that is expected to improve the survival to 3 or 4 years or maybe beyond. And a lot of new developments in the molecular treatment like ardafitinib and many other targeted therapies are coming up which are expected to improve the survival of this patient even beyond that with minimal symptoms. So our aim is to lead to the research that will convert these deadly tumors into the chronic diseases like asthma and BP and diabetes and so on and so forth. That with simple treatment without toxicity, we can offer the patient meaningful and prolonged life.
Amazing, sir. You have touched almost a major part of the treatment paradigm. I have one more question. Like many of the times in our country, like I have seen friends, families, and a lot of people. Like they are always told by the oncologist that okay, आपको बहुत देर हो गया आने में, and this is in stage 3, stage 4. I'm sure you also would be seeing the same thing in your practice. What are these few things that common people have to keep in mind that how we can stay healthy when it comes to the bladder cancer or urinary cancers?
So the first thing is to take it when it is early, before it becomes too advanced, right? So the important thing is to go to a urologist, get appropriate investigation. And the first investigation, the simple investigation is ultrasonography of urinary bladder. Very simple, available in every nook and corner of even smaller cities as well. So that will give us a lot of information about the possibility of bladder cancer. And if there is a possibility, कभी कभी ये लोग सोचते हैं कि ये कहाँ डॉक्टर के पास जाएंगे, कहाँ स्पेशलिस्ट के पास जाएंगे, चक्कर में चला देंगे। तो ऐसा मत सोचिए। अगर आपको ज़रूरत है, आपके आपके डॉक्टर ने बोला है, तो पीछे पड़ जाओ, छोड़ो मत। अगर अच्छे से पकड़ पाएंगे तो उसका क्योर कर पाएंगे। अगर क्योर नहीं होता तो लंबा इलाज करने से लंबी लाइफ भी मिल पाएगी।
सर एक लास्ट क्वेश्चन कि ये क्या चीज़ें होती हैं, क्या सिम्टम्स होते हैं, कब जो है व्यक्ति को एक सीरियसनेस आनी चाहिए कि भाई ये कुछ सीरियस हो रहा है ब्लैडर में या हमारे सिस्टम में?
अगर बार बार स्टोन निकला करता है ब्लैडर में से, अगर बार बार बिना स्टोन निकले ब्लीडिंग हुआ करता है यूरिन में, या यूरिन में बर्निंग हुआ करती है, एक बार बर्निंग हो गई, एंटीबायोटिक दे दी सोच के कि इन्फेक्शन होगा, अच्छा हो गया, महीने 2 महीने में फिर से आ गया, 2-3-4 बार फिर से बार आया करता है, तो यही सिम्टम है ब्लैडर कैंसर के, जो यूरिन ट्रैक इन्फेक्शन के होते हैं या तो स्टोन के होते हैं। अगर बार बार होता है तो एक बार जांच करवा लो, कैंसर तो नहीं है।
थैंक यू सो मच डॉक्टर साहब। आप देख रहे हैं मुझे यानी कि विवेक शर्मा को विद वन एंड ओनली डॉक्टर चिराग देसाई। थैंक यू। थैंक यू सर।